Good afternoon. Thank you for joining us today. My name is Sophia Chansey. I am the Chair of Education Committee for Northern California HIMSS. And today I am proud to present a webinar on remote patient monitoring. We are joined today by our facilitator, Dr. Nick Tehrani. Nick is a veteran of the Northern California HIMSS board, and I have the absolute pleasure of serving on the Education Committee with Nick. We have, as I said, a fantastic panel today talking about remote patient monitoring. And with that, over to you, Nick.
Welcome to another wonderful event of Northern California chapter of HIMSS, and thank you for joining us. At first, I would like to extend my sincere gratitude to our esteemed speakers, as well as my beloved team members who made everything possible for this event. Please allow me to begin by covering a few housekeeping items. First of all, everyone will be muted except for the speakers, so please do not unmute yourself. If you have any questions during the first 40 minutes, please write your questions in the chat box below. After the speakers are done, and if we have time, we will respond to your questions. Otherwise, you can ask questions when you go to the breakout rooms. In the breakout rooms, you can move around from one room to another as you wish. You get to know the speakers and one another. Thank you. At Northern California chapter of HIMSS, we are committed to the educational development of our members and the community. We offer multiple educational events throughout the year. Please feel free to visit our website for more details. Now, with regards to our topic for today, ever since the global health terrifying condition over the last year, the world of medicine took a shift and things started to change and improvising in new ways we had never seen before. In this 1 year, there have been multiple inventions that have taken the medical world to another level. Today, we have 3 wonderful speakers for you who will talk about the benefits, challenges, technologies, and opportunities available for remote patient monitoring. At first, I would like to go ahead and introduce our speakers. Our first speaker is Mary Buckland, who is the founder and president of Mobile Healthcare Providers Network. Mary is a family nurse practitioner, and her experience as a family nurse practitioner encompasses internal medicine, family practice, urgent care, hospitalist, nephrology, as well as hospice and palliative care. Our second speaker is Saeed Azimi, CEO of Denials Corp. Saeed has over 35 years of technology engineering and executive management experience. Saeed is also a prolific inventor with over 60 patents. Our third speaker is Lane Thrale, who is a nurse practitioner and educator, as well as the director of clinical education at mynurse.ai. Once again, thank you for accepting our invitation to speak at this webinar. With that, I would like to ask Mary to start her talk and begin by sharing with us, how do you think remote patient monitoring benefits your specific patient population? Mary, please.
Thank you, Nick. Thank you for the opportunity to be a part of this and to hopefully enrich other people's learning and to be able to serve our patients better. I wanted to start, go ahead and start the slide for me, please. I wanted to talk about why we had some pitfalls in the past, and with my medical practice, we actually had to stop our efforts to do chronic disease management. And I'm doing this as an effort to give everybody the information that they need. So hopefully it doesn't happen to them. Although I do feel like now the changes that are taking place with technology are really going to help us be more successful in providing remote patient monitoring and chronic disease management. Some of the things that we discovered along the way when we attempted to do this about 6 years ago was data collection was so very arduous and it was very time consuming. And with the margins so slim with Medicare, we found that we were using too many resources in order to be successful in a program. My staff was spending so much time trying to chase after metrics in order to get that information to the providers so that they could review the plan of care. And it was met with a lot of frustration. Our patient population that we serve are those that live in adult family homes with 24-hour caregivers. And for many of those caregivers, English is their second language. And so we were also trying to figure out ways to effectively communicate with the caregivers and them to communicate with us. And that was a tremendous barrier as well. We also found that the caregivers weren't necessarily vested in the process of what we were trying to do. They didn't understand the meaning or the purpose of what we were trying to do. We also found that they were very fear-based in their approach, that if they did something wrong, whatever their perception of was wrong, that they would get turned into the state or shut down. They are very highly regulated because of the patient population they serve. And many times we felt that some of that information was embellished and it wasn't accurate because it was based on fear and not knowing. The other thing that we accepted responsibility for was that the caregivers rely on nurse delegators who are licensed nurses to educate them on the process and the procedures. And so many times there was a delay in the education and retention of the information that was very challenging. We accepted responsibility that we really should have gotten the nurse delegators on board in order to pass the information along and to be able to continually reinforce the need for such processes. Next slide, please. The other thing that was extremely challenging, and I think any of you that have had to work with Medicare can appreciate this, we really couldn't find the roadmap on how this was to be done. Our billers were spending lots of time trying to figure out how to set a program into place and how to bill effectively for it. And we were getting lots of denials because when we reached out to Medicare, it really truly depended on the person that we spoke to as to what their interpretation of the regulation was. It was very subjective. And that also was very frustrating because we would put a plan into place based on what our conversations were with other people at Medicare, and then it would be denied. We talked to somebody else and they were telling us they had done it the wrong way. So once again, lots of resources wasted without any financial gain, and first and foremost, without having an effective plan of care for our patients. The billers really did struggle with trying to get bills submitted. At the end of the day, at the end of the project, we tried for about 6 months. We received so many denials that we decided that it was time that we had to step away from it to save our practice fiscally, because our practice is primarily Medicare and some Medicaid, which the margins are so very slim for this patient population and for a medical practice to thrive. So it was fiscally a huge pitfall and a risk. The providers became frustrated, and for the sake of their work-life balance and satisfaction with their work, we decided to stop. Next slide. The reason we decided to dip our toe back in the water, if you will, this time was we are finding out that there are devices out there now where they can give us those metrics, that there's applications that we can use. So once we get a plan of care in place and we train providers, or I'm sorry, we train our staff and the caregivers on how to utilize the machine, that they can upload that information. It can be uploaded very easily, streamlined, and to the provider, they can review those metrics very quickly, adapt the plan of care, get that information back to our MAs, and then it's disseminated or distributed back to the place where the patient resides. With looking at the different components of, for instance, we're looking at DynaSense, looking at this particular piece of equipment, we felt that it really would give us objective data that could be transmitted easily, and the providers can review the information very quickly without multiple spreadsheets and a lot of the other things that we were having to implement before. The unit itself was very user-friendly. I am not a tech person at all, and it seemed very easy to use. It's user-friendly, And I felt confident that with a little bit of training and reinforcement that the caregivers could be successful in utilizing it as well, and it would not be time consuming for them. Therefore, reducing their frustration that they might experience on their end, and hopefully getting them more vested in the process. The other thing that we noticed is the patients aren't burdened with varying equipment to get the data that's needed for disease monitoring and management. And we're hearing that the families of these patients are very excited that if we can do more intensive monitoring, that we can avoid unnecessary hospitalizations, and we can keep our patients living in place, aging in place, and avoiding hospitalizations, which aren't always the best solution for a person as they age with disruption in day-to-day processes. And that is what I have. I hope that this is helpful, this abbreviated portion of my lecture, but I wish all of you the best, and I wish all of our patients to be as happy and as healthy and reduce the risk of symptom burden as much as possible. And thank you very much.
Thank you, Mary. That was wonderful. Now, I would like to ask Said to share with us what is under the hood for remote patient monitoring. Said, please.
Thank you, Nick. I'd like to welcome everybody. My aim is to highlight individual elements of an effective technology system for RPM or CCM, which is chronic care management system, since both are very similar and in fact can now be built together. Since I have less than 10 minutes, I'm going to highlight each element briefly, as comprehensive review merits several sessions to cover it all. I also like to try to provide my personal view of future development needs. So with that in mind, let's get started. Nick, please click to start the slideshow. For remote care starts with sensing on daily basis on status of the patient. So an effective RPM system must be able to collect such information from a variety of sources. What are these sources? There are three categories of sensing. Most obvious is physiological data, such as vital signs, blood sugar level, activity like Fitbit or Apple Watch, posture, EKG, weight, or skin lesions captured by the smartphone. So there are many ways to capture these physiological health metrics. As an example, my company provides comprehensive kits for capturing physiological data. There are also companies working on other advanced at-home measurement for a variety of other health metrics, like COVID-19 test, DNA, or in case of DynoSense, breath gas analysis. So they're coming, and RPM technology must be able to capture data from such diverse sources. The second category of data is psychological data that provides insight into a patient's mental health status. Today's powerful mobile devices with their advanced camera and speakers can capture subtle changes in speech or expressions for analytic to predict onset of dementia or changes in mood. Speech recognition make it easy to ask questions and patients respond in natural language instead of text surveys. The third source of sensing data are from EHR EMR systems that include in-hospital lab data plus physician notes that provide the human input along with to-do lists for patients, like medication regimens. So once you have all this data, the next step is of the element is the cloud. All sensing information must now be gathered into the cloud-based RPM system, as without an effective cloud system that is built around advanced microservices architecture, we cannot possibly do justice to pushing limits of RPM and CCM to be a revolutionary remote healthcare management system. Cloud computing is here, reliable, quiet, cost-effective to deploy and manage. Once data is in the cloud and talking to other third-party systems like EHR, you need algorithms to create correlation, trending, and predictive output so that this data can go from raw data to actionable data. We all know of advances in machine learning, AI, that can sort through data that is growing exponentially by the explosion of sensory data available and stored into the cloud by the RPM system. Key to making any data actionable is for analytic engine to produce alerts. This is a big topic of its own. What kind of alerts? You can easily overwhelm care managers with nonstop alerts, a condition known commonly in health management as alert fatigue. Even in ICU care units that are heavily staffed 24/7. Intelligent alert must accompany smart escalation, which is the topic of the next element. In a typical RPM CCM environment, you have a care coordinator, care manager, that might be registered nurse, and then physician or physicians responsible for eventual care of the patient. I believe a scoring system, which is another big topic of its own, is the most viable approach to escalation and alerting from the time a new data is made available that may indicate change in the direction of how a response must be formulated for that patient. Once you have a smart escalation within the RPM system, nature of the response becomes easier. Is it a simple change in medication or online telecare visit or change in health dietary plan? All these can translate into a series of to-do actions for the patient that must be tracked by the RPM system. So the next step is reporting. In healthcare, reporting and logging is a critical part of the activity of ensuring smooth follow-up with patients, as well as meeting regulatory requirements for billing and payment. So RPM system must provide easy to use dashboard for generating correct reports. A new patient health plan translates into a new set of actions that must also be tracked by the RPM system. Obviously, you can note that tracking a patient action plan or to-do list itself can generate a new set of alerts to the patient, follow up with the recommended change. This will take us back to the sensory part. If you're still awake and with me, you understand my initial point about sensory categories as not just about device data. Next step is care managers, care coordinators, caregivers, physicians, maybe even family members are all part of the care team. The RPM system needs to understand and provide easy to interact among groups with different requirements. It must also be easy to train all parties. Our practicing speakers, Mary and Lane, are sharing their view of benefits and challenges of RPM that an effective technology must address to be successful. So let's listen to them very carefully. As Mary noted, everybody needs to get paid, and healthcare system places a series of requirements on how to bill for a service. RPM must also address requirement for generating correct report for the billing purposes. The next step is understanding the privacy aspects. In many countries, there are very strict rules like HIPAA in US around privacy of medical data, even more than your financial data, when penalties are higher to intentionally leak health data of a patient than, say, bank account statements. Like our sibling EHR EMR system in existence in healthcare, RPM technology need to address privacy. Which brings me to the last topic, security. Specifically, cybersecurity, which is most difficult in cloud, where not all software tools are 100% coded by RPM provider, company like DynoSense. Many other third-party plugins are involved, and even Amazon Cloud legacy operating systems are all potential sources of intrusion, in addition to human aspects like an employee unknowingly falls into disclosing access keys. This completes my overview. As I indicated, there's a lot going on, and I hope I was able to provide a better understanding of the technology pieces with audience wanting to learn more. If there is enough demand, I'll be happy to return to look more under the hood. Thank you, everybody.
Thank you, Said. I can't wait to host another webinar and have you address all these elements listed in this beautiful image. With that, now I would like to ask Lane to elaborate on the benefits and opportunities associated with RPM. Lane, please.
Well, thank you, Nick. So with the brief time that we all have together today, I'm going to hit the highlights of my personal observations as a family nurse practitioner and a nurse educator working with a startup company, mynurse.ai, where we deliver remote patient monitoring along with chronic care management services to ambulatory seniors. And I'm emphasizing our population because my perspective is a little bit different from my fellow speaker, nurse practitioner Mary Buckland, who spoke earlier, because she is serving a senior population that is in care homes. And my experience with RPM so far has been working with a population of ambulatory seniors. And so either way, whether you're working with either population, our seniors have multiple chronic conditions, and they really do benefit from remote patient monitoring in achieving those optimal outcomes that we all want them to have. And so this slide talks about the benefits of remote patient monitoring for both patients and providers. And this list, I just want you to know, could be a whole lot longer, but we need to keep it short today. So I will do my best. The big idea here to keep in mind is that remote patient monitoring provides healthcare support in between the scheduled office visits that our seniors have. And we all know that, especially if they have multiple chronic conditions, they have a lot of those medical appointments. And these days, a lot of them are telehealth, but they've still got a lot of them. And so remote patient monitoring can really serve us well in that in-between time. And what I also want to point out is that the benefits to the patient actually become the benefits to the provider. And to clarify, I'm talking about primary care providers and condition-specific specialists that our seniors with multiple chronic conditions in the ambulatory population are regularly being referred to. So one of the most significant highlights for me has been to see the benefits of remote patient monitoring and how they need to be spelled out and repeated over and over to both the patient and to the provider. And this is because everybody is so busy that they feel like, how can I add one more thing to my day? So the patients are saying this on one hand and the providers are saying this on the other hand. And so how do we, make that happen? And it's just repeat it and emphasize it and just keep saying it. Eventually it will catch on. So for our patients, remote patient monitoring is a gateway to self-confidence for managing their health in between their scheduled office visits. And, we talk a lot about improved health outcomes, but from the patient's perspective, what they really want is to feel better and to achieve that quality of life. And they don't really often understand and have not connected the dots for themselves fully about those darn numbers that the doctor wants them to improve and track, and how is that going to make them feel better. So when we can do that for them, then all of a sudden it starts to click and they want to participate with RPM, and they will start to recognize those RPM devices as tools for helping them have better health, and they'll get excited about using them. And they will learn as they go, and they'll start to see and learn what those numbers that they're seeing in real time, what they mean and what actions to take next when they see those numbers. And it's truly, it's a fundamental building block RPM can be for achieving improved health outcomes. We've also found that our patients with RPM in their lives can have fewer health scares, which may seem counterintuitive at first because sometimes the patients will object and not want to participate in RPM because they'll say, oh, well, tracking my numbers makes me nervous. I don't want to see it. I don't want to think about it. I just really rather not. But what ends up happening when they can embrace it and when they're allowing us to have a deeper conversation with them, we can help them understand that if they are someone who has had a lot of ER visits, if they are someone who has had long hospital stays from those chronic conditions that they're going to be living with for the rest of their lives, that paying closer attention to those numbers associated with them can help prevent some of those events from happening where they have to go to the hospital so many times, and they can get the help they need in a timely manner. And that is very, very comforting once they start to realize that. Remote patient monitoring really does move us as providers towards being able to provide truly personalized medicine without genetics involved. And it enhances our predictive and preventive capability over time as well with the data that we gather so that we can recognize patterns when they start to emerge. And these are so much more helpful than the mere snapshots of data that we have traditionally gotten in those standard Western medicine office visits that we all learned about in school. And we can translate that to a benefit to the patient by helping them understand that the more data they send to us, the better their doctor can help you. So your data that you send us through these devices helps your doctor help you better. And once they understand that, you know, wow, they start to get excited. They start to ask better questions. Health and medicine starts to be demystified for them. And all of a sudden, they're engaged in a way that, you know, we always struggle to have better patient engagement, but now our patients can be that way. And the data also will help. It's just amazing how knowing more of what's going on in between those spot checks, those snapshot office visit times, when we're prescribing multiple medications, new medications, have multiple prescribers involved in the patient's plan of care, the more data we have and the more we can share it amongst ourselves, the better we're able to titrate the dose, the better we're able to identify adverse effects or any of those other things. I will stop there in the name of time on this slide. So let's go to the next slide. So we'll just talk briefly about how all those benefits that I just listed and promised that there could be more than you even saw on that slide, they may sound too good to be true. So let's acknowledge that there really are challenges. And Mary did such a good job earlier of mentioning some of those that she has experienced in her company with her population. And first of all, I just have to say that Saeed was absolutely right when he said that the RPM needs to be fully integrated. You know, it needs to be a whole system. It's a whole package. There's so many components to it. And it not only needs to be integrated within itself as a fully functional application or fully functional system, but it needs to be fully integrated into the patient's life and into a provider's practice. And for that, some amount of behavior change is required. And it can be a big deal. And we know how hard behavior change is when we're managing seniors with chronic conditions. And now we're adding another layer on with asking them to use devices and get used to them. But when RPM is being used and providers have integrated this, you know, it can be a source of wonderful information, but what does that look like? What does it mean for our practice? What does it mean? Because we didn't learn this in school, most of us who are out there practicing now. And it's going to take education a little while to catch up with that. I promise I'll talk about that later. But in a fully integrated system that includes RPM, it really can actually free providers up to see more patients, because RPM, along with telehealth capabilities, can really help decide, you know, help the patient decide, help the provider to decide, you know, when to come into the office to be seen, when to schedule those appointments. Do they need them more frequently? Do they need them less frequently? Do they need to just go right to the hospital? You know, don't pass go, just go straight to the emergency room. So this is very helpful, and it's very helpful for shared decision making. And that could be a whole nother webinar topic. So maybe we should make note of that. So we can meet again. But back to behavior change, patients, of course, are faced with building the habits that they need to consistently and regularly send data through the RPM system. And this can fit right in with any other type of behavior change that we might already be doing for our chronic condition management. So, some patients are always going to be more engaged than others, but really the tool, once they see how useful it is, it can start to help be a gateway to get them interested. And we do know that the new rules that CMS has implemented for 2021 with Medicare billing requires 16 days of data in a 30-day billing period. And, sometimes that's a bit of a challenge. So we're working our way through that. So just to the point that Mary was making earlier, navigating how does the billing rules, how do the regulations all fit together with the behavior changes that we are trying to implement with our patients to make it all work. And we're still pioneers in this. This is still early days for everybody. And then there's the fear and the anxiety that inevitably shows up with both patients and providers when we talk about having more access to this data and having it in real time. So we do a lot of teaching and reassurance with our patients, teaching them things like, look, here's what you do when you see a number like that. Here's what it's telling you. Here's what actions you need to take next. Take another reading, see if your numbers are changing, depending on what you see from that. That's your clue to call your doctor, get the emergency help that you need right away. And so when patients start to learn these things, they start to get more confident. And some of them, we may feel like as providers, we've told them this before, but it may just never have clicked for that patient. And finally, when it does, when they've got the device in their hand and they see the information right there, it all starts to make sense. And it's really important because the fear and the anxiety can start to escalate for a patient when they're in a cycle of indecision. Should I go to the emergency room or not? I'm scared to go because of COVID, all these decisions, and it can make whatever the medical condition is a whole lot worse. And so actually the device, when they learn to trust it, when they learn to use it, when they feel confident in the teaching that goes along with it, it can help to de-escalate some of those situations. And for providers who also may have a sense of fear. So I'm going to go back to the fear factor that the providers may have just briefly. They may feel like there is liability and responsibility associated with that. And I just want to make the point to any provider who may be listening to us today and may be on the fence about, should I have RPM in my practice? Should I not have RPM in my practice? I'm not sure I can take on the liability that all that extra data might bring. And I would say, remember what happened when EMRs were new. Remember what happened when we were all afraid that the EMRs and the mandate to have them was going to do exactly the same thing. It was going to increase our liability. And we have all adapted and managed to navigate through that process. And I would say that the advent of RPM is exactly the same, that we will also learn how to navigate through the advent of this. And if you think about it, then the RPM is actually going to help us reduce the provider's liability because it's going to be able to help us get to those health outcomes that we so desperately want all of our patients to have. And again, in the interest of time, we will just move on to the next slide because I'll bring education into it as well. The transition here is that all the challenges that I just talked about really are, in fact, opportunities in disguise, right? And so the piece that we skipped, I'll start at the bottom of the slide and work back up because we haven't talked enough about education so far. But education, there's a little bit of a gap there because technology doesn't move as fast as the education curriculum does. And we all know in healthcare education that the curriculum is packed. There's not time to add one more thing, not one more topic to a semester's curriculum or a quarter's curriculum, depending on what system you're in. And yet we didn't learn how to do data interpretation skills in school. And so these are things that we really do need to learn. So these are the gaps, but that is such a big opportunity. It's almost like there's this dawning of a new age of a renaissance for nursing informatics. It's not going to be the most boring chapter in your Nursing 101 textbook anymore. It's actually the hottest thing, the hottest specialty that nursing has going when you stop to think about it. So it's really an exciting time. It's also an exciting time to really get familiar with and comfortable with the idea of behavior change and how to coach patients through that, how to help patients understand how to build healthier habits. And so many times these are the things that get shelved in the nursing curriculum or the medical curriculum as those soft skills in medicine that might matter anymore, or may not matter as much as the pharmacology and the dosing and everything else. But with the advent of technology and with everything else that we need to bring together, helping people with behavior change is one of the most important things we can do. Improving patient engagement is the ultimate in how it all fits together. And I realize that we are running short on time. I was afraid that was going to happen. So what I'm going to do is I'm going to stop there, and we can take our future conversations or our questions that may have come up into our breakout room.
Thank you so much, Lane. I think I still have 1 or 2 minutes before we go into the breakout rooms, and my apologies for that change of slide. Perhaps maybe I can share my personal experience and ask you a question about this. I know you touched on this a little bit, but I recently spoke to an 80-year-old man regarding getting enrolled into a remote patient monitoring, and he said he's not interested to know about his health metrics, as he only have 5 more years to go and he doesn't want to worry. So in your opinion, how do I encourage this person to participate? If you can answer it in 1 or 2 minutes, please.
Well, absolutely. Well, that's a really important question, and it's a question that comes up all the time. You know, as a nurse, personally, my first instinct with a patient like that, if they were talking to me, would be to, ask them some more questions and get to know them and their situation a little bit better. Why does he think he only has 5 years left? And that will tell me a lot more. But if you're not a nurse and you're not used to asking those kinds of additional questions when a patient asks something important like that, is to just say, well, why wouldn't you want your next 5 years to be the best they could possibly be? And if you knew that you had a tool that was so easy to use, and I can show you how to use it right now, if you knew you had a tool that could help you do that, why wouldn't you want to at least try it? At least give it a try. And a lot of times patients, when they're presented with it that way, will start to soften up a little bit and will start to get curious and give you an open door to show them more and get them interested.
Fantastic. Thank you so much. I appreciate that. Thank you. Now it's time to go to the breakout rooms and meet the individual speakers. I will see you all back in about 15 minutes or so. Thank you.